Cough is probably one of the commonest reasons people visit their doctor. Cough is a sudden, audible expulsion of air from the lungs. It's usually caused by infection, but there are many other reasons why people cough. We thought we'd show you a few examples of different coughs. Everyone knows about the common cold. Cough often comes with a cold. Caused by the rhinovirus and coronavirus, it takes a couple of days to get, and you're contagious from the day you get the cold until several days after. There's not much to do for a cold. You can try some vitamin C. It may have some protective effect. Chicken soup feels good. To avoid getting a cold in the first place, you want to stay out of the path of a sneeze. Tom, would you show us the cough of a cold? That's good. Asthma is often seen in families where there is a history of asthma or eczema, a skin condition. Asthma involves three things: mucus plugging the airways or breathing tubes, swelling of the breathing tubes, and tightening of the muscles that surround these tubes as well. The medications used to treat asthma target one or all of these areas. An asthma attack can be brought on by many things: illness, allergies, exercise, exposure to cold air. Some puffers taken prior to exposure to cold air or exercise can help prevent an asthma attack. Tom, please demonstrate the cough of asthma. That's good. Pneumonia is usually caused by a virus, but can occasionally be caused by bacterial infection. The incubation period ranges from 3 days to 3 weeks. In the case of bacterial pneumonia, you're contagious for at least 48 hours after antibiotics are started. Pneumonia is often accompanied by fever, chills, and sweats. There is a vaccine available to prevent a certain kind of pneumonia that's recommended for all people over the age of 65. Tom, can you demonstrate the cough of pneumonia? That's good. The cough of chronic bronchitis is usually seen in smokers. It's defined as a productive cough, that is, productive of sputum, lasting 3 months of the year for at least 2 years running. The first thing to do is to quit smoking. Many of the medications used to treat chronic bronchitis are the same as those used to treat asthma. In the later stages, it gets difficult to do too much, and sometimes oxygen is necessary. To avoid getting chronic bronchitis, don't smoke. Tom, can you demonstrate the cough of chronic bronchitis, please? That's good. Croup, or laryngotracheobronchitis, is particularly worrisome in infants and young children. It's caused by viruses passed in the saliva and stool. Some of these viruses can survive in swimming pools and be passed on that way. Parainfluenza virus and respiratory syncytial virus, or RSV, are the commonest causes of croup. The child is contagious from the day before the illness until several days later, but RSV can be shed for weeks after the illness. Tom, can you demonstrate croup? It's more of a bark. Really a seal bark cough. Well done, Tom. Pertussis, or whooping cough, is caused by a bacteria called Bordetella pertussis. The incubation period is about a week, but the contagious period lasts about 3 weeks. Antibiotics can shorten the period of contagion, but don't do much for the illness itself. Prevention is in the form of a vaccine, the pertussis vaccine, given in infancy and early childhood. Tom, would you demonstrate whooping cough?
What, or?
It's a staccato cough with a big whoop at the end. A big hoop. Are you okay, Tom?
I think I'm okay.